pungency. Now, what is pungency? Pungency is basically a bad odor, okay, or irritative odor rather, okay. Now, all that is kind of important to know about the pungency is regarding the practical application. It has nothing to do with the anesthesia effect and all those particular things, but it is more to do with the practical application. Now, let us understand the drugs which are having low pungency. Can you tell me the example of those? So, the drugs which are having the low pungency are halothane and sevoflurane. Okay, so if at all these two drugs are the ones which are having low pungency, that is the bad odor is not present in these particular drugs, what is going to be happening? When these particular drugs are being given as an induction agent, they are pleasant. The patient is kind of happy inhaling these particular agents, and that is why the drugs which are having low pungency are preferred inhalational agents for induction. Okay, for induction. Okay, now when we talk about the drugs which are having like high pungency, so what is going to happen because of the high pungency? Okay, so what is a drug which is like having the high pungency? The answer is desflurane. So because this is having like a high pungency, what is it going to do? It is going to irritate the respiratory tract. Okay, so it is going to irritate the respiratory tract. Okay, and because it is going to irritate the respiratory tract, it is not pleasant to the patients, and because it is not pleasant to the patient, it is not preferred as an induction agent. But when we talk about the maintenance agent, yes, it can be used. So please understand this point, okay? So induction agent means when you're putting that particular patient to sleep. Okay, yes, obviously at that point of time, the odor and the smell of that particular agent matters. But once the patient is already knocked down, after that, what if the drug you give, if at all, even if it is having like high pungency, it is still fine. So all you need to understand is that desflurane, it is not a preferred induction agent, but yes, for the maintenance, yes, it can be used. Okay, so I hope you have understood this particular concept. Now, let us dive deep into the individual inhalational agents. So the first what we are going to talk about is about the nitrous oxide. Now in the nitrous oxide, what we have covered is that, what is a MAC? Can you please tell me? I hope you remember. The MAC of nitrous oxide is 104. Okay, so it is very high, and because of this, it is not a good induction agent. But at the same time, what you need to understand is that the nitrous oxide, it is having the rapid induction and emergence. So even though the potency is less, the rate at which the induction and the emergence is happening, that is kind of a bit high. So that is why, even though nitrous oxide cannot be used alone, what we can do is we can combine the nitrous oxide with other agents which are potent, and these two together can be used for induction. So this can be used for induction. Are you understanding this point? Okay, so nitrous oxide per se on its own cannot be used as a sole agent for the induction, but yes, when we combine it with some other potent agents, yes, it can be used for an induction anesthetic. Okay, now it has another thing which is called as a blood gas, like the second gas effect. So what happens is, as soon as these particular nitrous oxide along with the other drug is reaching the alveolus, this nitrous oxide quickly diffuses into the blood. So the space is kind of created in the alveoli, and the more of the second gas can come, and that is kind of more potent. So it basically enhances the effect of the other gas as well, and that is what is called as a second gas effect. So all you need to understand is that second gas effect is something which is associated with the nitrous oxide. Now, when we compare the nitrous oxide with the nitrogen, what you need to understand is that it is 30 times more soluble than nitrogen. Okay, so because it is 30 times more soluble than nitrogen, what happens? It basically quickly diffuses into closed spaces. Okay, so it quickly diffuses in, and yeah, like it also kind of like as compared to the nitrogen, it basically quickly diffuses into these particular closed spaces. And because of this, what happens? There is an increase in the volume and increase in the pressure in those particular closed spaces. Now just imagine if at all the patient is having pneumothorax. Let's say you're operating the patient for, let's say, small bowel obstruction. Let's say you're operating the patient for a retinal surgery or a middle ear surgery. Would you advise the anesthetics to kind of use the nitrous oxide? No, not really, right? So in these particular procedures, the nitrous oxide is contraindicated. Okay, so I work in a hospital where like there's a team and there's one consultant. So whenever he comes, the first thing in the laparoscopic surgery, the first thing he asks the anesthetist is that, what are you giving nitrous oxide? Why? Because as you can see that it can enter into the closed spaces and it can kind of cause the volume expansion. And in the laparoscopy, what the basic rule is that the bowel should be kind of collapsed. So is it contraindicated in laparoscopy? No, not really, but it is also not preferred agent in laparoscopy for the same reason, because it can kind of increase the volume, and if at all it increases the volume, it will be difficult for you to operate on these particular patients, and that is why it is not a preferred agent in the laparoscopy. Okay,